Hi, my name is Megan Raby. I'm here today to talk about cellulitis. Cellulitis is a common infection of the dermis and subcutaneous skin that's caused by a bacteria that has disrupted the skin's barrier. The most common cause of this infection is beta hemolytic streptococci, which all groups can be seen, but the most common is group A strep. Patients will commonly present with reddened skin of the legs, but cellulitis can develop anywhere on the body where there has been a disruption in the skin's barrier. Cellulitis develops after there has been an injury to the skin or tissue and a bacteria invades into the system. The body then reacts with an inflammatory response. Once the injury occurs, the damaged mast cells release chemical mediators such as histamines, cytokines, and prostaglandins. And when these mediators are released, the smooth muscles relax, which increases the diameter of arterioles and causes vasodilation. The blood flows increase to the area, and that's why patients will experience redness and heat to the site. Capillary permeability is also increased, which allows the plasma proteins to enter the interstitial fluid and dilute toxic materials. This is why patients will experience swelling and pain because of that increased capillary permeability. On a cellular level, chemotaxis attracts white blood cells to the area of inflammation. The neutrophils, monocytes, and macrophages migrate from the capillary walls into the interstitial fluid to destroy and remove any foreign materials, which in this case is the bacteria. Anyone can develop a cellulitis, even a healthy patient. All you need is a disruption to the skin's barrier or injury to the tissue. So a healthy patient who receives an insect bite or an abrasion can develop a cellulitis. Risk factors do increase with age. So the older you are, a diagnosis of diabetes or obesity will put you more at risk to have a cellulitis because of the deficiency you may have in your immunity, your skin integrity, and vasculature. Other patients that have disruptions in skin barriers are those with chronic skin conditions such as eczema, psoriasis, or radiation therapy. And then again, any other trauma that can happen to the skin, like an insect bite, but also venous stasis ulcers, pressure ulcers, IV drug use, and again, abrasions. Major signs and symptoms, as I had mentioned before, reddened skin that's swollen and warm to touch. Patients may or may not have a fever. Cellulitis can occur on any part of the body, but as I mentioned, is most seen on the lower extremities and is nearly always unilateral. Another defining symptom is swelling of the surrounding hair follicles, which leads to an orange peel appearance of the skin. And here I have a picture that you can see that angry, red, swollen skin. A cellulitis diagnosis is usually made based upon clinical manifestations. If we were to draw blood work, indicators that we would see would show an active infection such as leukocytosis because the white blood cells are elevated to fight against the bacteria. We would also see an elevation in C-reactive protein levels and erythrocyte sedimentation rate because of the body's inflammatory response to the bacteria. If a diagnosis is uncertain, they may order a skin biopsy. And I just put on here of note that less than 10% of patients with diagnosed cellulitis have positive blood cultures because it is such a localized infection. Very rarely, as you can see, does it turn into a systemic problem. Treatment of cellulitis depends on the severity of the infection. Patients with non-purulent cellulitis are treated with empiric antibiotics such as IV cefazolin or oral cephalexin. It's usually a 5 to 6 day course. But if the patient has a slower response to the antibiotic, if they have a more severe infection, or if they're at all immunosuppressed, the treatment can last for 14 days. That concludes my presentation on cellulitis. I hope you learned some things, and I hope you enjoyed it. Thank you.